You've met with the study staff and have been found eligible to participate, and you've decided to enroll in a COVID-19 vaccine study. Congratulations! Thank you for getting involved. Now what? What can you expect as a study participant? Each study has its own schedule of required visits to the clinic and phone calls with the staff. However, all of the studies have some types of visits in common. Depending on the study, you will have one or more visits where you get an injection in the arm. If the study requires more than one injection, the study staff will give them to you at different visits, usually about a month apart. After getting an injection, you can expect to wait at the study clinic for about 15 to 30 minutes. The study staff want to make sure you don't have any immediate reactions that may need medical care. This rarely happens, but the study staff want to keep everyone safe, so anyone who gets an injection will need to stay at the clinic for a little while. After each injection visit, the staff will be in contact with you to see if you have any side effects from the injections. People can have side effects whether they get the study vaccine or the placebo. Some of the most common side effects include things that are often known as flu-like symptoms. Those are things like a fever, chills, rash, aches and pains, nausea, headache, dizziness, and feeling tired. People also can have tenderness, pain, redness, swelling, or itching at the place on their arm where they got the injection. The vaccine being tested in your study may cause more side effects, and they were described in the consent form. Side effects usually go away within a couple of days, and most people in past studies say that these side effects are mild or moderate. People might need some over-the-counter medicine for their headache, or they may need to rest if they feel tired. But most side effects go away on their own, and most people don't need to see a doctor. The study staff will explain how to let them know about any side effects that you might have. They will also give you a way to contact them at any time. If you need additional care, they will help you get it. Besides the injection visits, there are other study visits that are just as important. It is at these visits where we take blood samples to see how your body is responding to the injections. The study staff will do other things too, like the doctor doing a physical exam, doing nose swabs to test for SARS-CoV-2, or taking saliva samples. The study staff will tell you what to expect at each visit so that there aren't any surprises. They will also ask you to be on the lookout for any COVID-19 symptoms. If you ever have any, please tell them as soon as possible. Remember, the study vaccine or placebo injections cannot give you COVID-19, but everybody has a chance of coming into contact with the virus in their everyday lives. If you get sick, the study staff will tell you what you should do. The studies are all about 2 years long. The staff will compensate you for your time and travel at each visit. It's their way of showing their appreciation and the major importance of your participation. Thank you so much for helping your community and helping your family, friends, and neighbors by being part of this research. If you have any questions, please contact the study staff. Your participation in this study is helping to move us toward a successful COVID-19 vaccine. Your participation as a volunteer can make it happen.